button, so there will be a here.
Okay.
Where's your camera?
Right here, Roger. Okay, you're recording.
Okay. So hello, everyone. Today I'm going to be training you on how to do a passive range of motion caregiver program. We like to do this with people who don't have active motion, meaning they can't move their arm on their own. They run the risk of contracting and then they totally lose any motion or flexibility. So this is a really preventative program. So today I have a resident and we are going to be doing shoulder flexion as the first one. I have these laminated handouts that I keep in the residents' rooms, and you certainly can use them as a guide. There's pictures, there's written descriptions, and then it says how many times a day and how many reps I want done. So today we're going to be doing 10 reps of everything. So this is shoulder flexion. I'm going to move his lap tray out of the way. And then you're going to try to straighten the arm, straighten the elbow as much as possible, and go straight up overhead. And you want to get to what we call end range, which is where it starts to get tight. Yep. And this gentleman can tell me when it's tight. I can also feel that. For the sake of the video, I'll just do 5 reps though. So kind of just a slow, continuous motion with a little bit of hold at the end. You can then let his hand rest.
I would like to point out how Molly supported the elbow and the wrist to do the flexion too. So it wasn't, he had enough stability to go up and down and we weren't grasping and holding very tightly on him.
Correct. Yep. The next exercise in our handout is called shoulder abduction. So when I teach patients this, I like to think of it as doing a snow angel motion. So kind of an arc out to the side. So with this gentleman, I'm going to support the same places. So supporting under the wrist and under the elbow. My fingers are kind of straight. They're loose. I'm not squeezing much. Straighten that elbow as much as he can tolerate. And then we're going to go up like a snow angel. Nice and slow. Sometimes it's better to start slow because they can oftentimes be stiff on the first couple of reps. Sometimes the more reps you do, the more they loosen up, and you can then stretch them a little bit further. I always encourage people to watch facial expressions and just listen for any sort of like verbal expression that the patient's having trouble tolerating.
I hear it.
So there, that would be pretty full motion. I'm then gonna let him rest and refer to your handout for the next one. So this one is called horizontal abduction and adduction, meaning that arm is going to be straight out in front, level with the shoulder. You're going to come across and then out to the side. So I support the same places under the elbow, under the wrist. We're going to go across his body and away. I would say the away is more the important part. As for the functionality of why these are important, it has to do with being able to dress people, being able to transfer them. Motion is really important. And ultimately by doing it should help decrease the difficulty that you guys have providing cares. And so that is a wrap on horizontal ab and adduction. We'll then progress to the hand and wrist. So the first one is finger flexion and extension. So I'm gonna bring the lap tray back up. That way I have something to support his elbow and forearm on. And I'm gonna try to straighten his fingers, including the thumb. Yeah, you can come over. We're trying to straighten them and then help make a fist. And then open. Can you open your hand as much as you can? Bring those fingers straight. And then I'll assist the rest of the way. And make a fist. Therefore, I'm allowing him to keep the active motion that he does have. Now straighten your fingers. And then open them up. Go ahead and make a fist. Tight as you can. And open those fingers up. Okay. Then we proceed on to wrist ulnar and radial deviation. So this one can either be done this way with your fingers pointing forward or with your palm facing the ground going side to side. In this situation, when I'm doing this, I like to grab hands like I am going to shake their hand, supporting under the forearm and the wrist. And then I go down and up, down and up. It's just support my pointer finger. I'm not really doing much. So, and there again, you'll be able to feel end range. Full motion would be like what I have here. So that's kind of what you're looking for. I think, Melissa, you could stay there for this one. The next one we'll do is wrist flexion and extension. So bring that hand fingers down and fingers up. And in his case, he has a little bit of extension. So I'm gonna support under the wrist, grab onto his hand, push him down a bit. Now go ahead and pull your hand up as much as you can. So you'll see he has a little motion there, and then I'll help bring it up the remainder of the way. And it goes down. I'll provide more pressure going down. Now pull up. Allow him to move as much as he can. And then up we go. You feel some tightness in that wrist, don't you?
Yep.
Yeah. And down. Now pull up. And then I help assist the rest of the way till we get to a good stretch. Okay. Then the last wrist one is called forearm pronation and supination. So I like to think of this as alternating from palm down to palm up. Palm down, palm up. So again, I'm going to grab onto his hand. You can support the elbow, or in his case, it's resting on the lap tray, so not totally necessary. So you're gonna go palm up, palm down. I think it's helpful again to link hands like we're gonna shake hands. Alternating palm up and down. And then the last exercise that we're gonna do today is elbow flexion and extension. So think of like a bicep curl, allowing that elbow motion. So again, I'm gonna leave his elbow supported on the tray table. And go up and down. It can be helpful to support the hand as well as near the wrist. Moving up and down. Now, as I do like these wrist motions, this elbow motion, I'm not actively grabbing at the wrist because that would restrict their motion. So just try to be mindful of where you're grabbing on so that you're not restricting motion in any way. In his case, it's important to come all the way straight, trying to get that elbow as open as it can be. So that is a wrap on passive range of motion. Certainly, if you guys ever have any questions, I'm more than happy to answer them. Pop down to the therapy office and I can give you a quick run through. Thank you.